Hey, hi everybody. Good afternoon. Thank you for joining us for the 2024 Society for Health Psychology's Awards and Recognition Ceremony. I am Dr. Stephanie Fitzpatrick, the 2024-2025 President of the Society. Some of you may have participated in ceremonies previously held during APA conventions, but to allow more members and guests to attend, we have now gone virtual with our celebration. Before we begin, we have a few items to share. This event is being recorded. Anyone who speaks during it is agreeing to be not reported, I'm not reporting anyone to anything, agreeing to be recorded and is granting permission for the recording to be posted on our website. We suggest that you select speaker view on your device, and I ask that you all mute yourselves when you're not speaking. I'm now pleased to turn the program over to Dr. Barbara Ward Zimmerman, past president of the Society and 2024 Awards Committee Chair. Dr. Ward Zimmerman.
Thank you. So each year, the Society for Health Psychology recognizes members for outstanding contributions to the field by presenting awards in research, clinical practice, education and training, mentoring, and career service. Award categories were established to acknowledge and appreciate excellence in health psychology across the career span and throughout the field. As chair of the awards committee, I want to take this opportunity to express our sincere appreciation to all the honorees, nominators, applicants, and reviewers. The 2024 awards cycle included more than 40 nominations across our 8 annual professionals awards, vetted by dozens of expert reviewers representing all Society for Health Psychology councils, committees, and interest groups. After you hear from each award winner's introducer, we have asked our recipients to share a few words of inspiration in response to one of the following prompts. One lesson I would offer to today's health psychology students or trainees is. The next prompt that they could choose from: one moment that shaped my career trajectory was, or I found unexpected inspiration for my work through. We look forward to hearing their insights. We will begin by recognizing our mid-career and senior award recipients, then follow with awards to our early career professionals, students, and special recognition for society service. Our first award is the Nathan W. Perry Jr. Award for Career Service to Health Psychology. The 2024 honoree is Dr. Mark Lumley of Wayne State University, who will be introduced by Dr. Daniel Bruns. Dr. Bruns?
Hello, hope you can hear me okay. The highest award our society has to offer is the Nathan Perry Career Service Award. It's my great honor to announce this year's recipient is Dr. Mark Lumley. Dr. Lumley is a distinguished professor at Wayne State University in Detroit, and his career and research have been remarkable. Dr. Lumley has published over 200 peer-reviewed studies, is the recipient of 32 grants, and has already won numerous awards for his work. Dr. Lumley is receiving this year's Perry Award for his lifetime of work on chronic pain. For decades, the dominant model of chronic pain treatment has been cognitive behavioral therapy. To a significant degree, these methods have their origin in Stoic philosophy, and not surprisingly, they involve techniques to control or suppress emotion. But Dr. Lumley approached the problem of chronic pain from an entirely different perspective. Over the course of 33 years, Dr. Lumley published over 120 articles on the relationship between pain and unexpressed emotion. He later developed a novel psychological treatment for pain called Emotional Awareness and Expression Therapy, or EAET. This treatment helps patients express their feelings as opposed to suppress them. So far, despite the difference of this type of approach to CBT, EAT has been shown to be highly effective and has shown to have impressive effect sizes as well. So in recognition for this remarkable lifetime of work, it's my great pleasure to introduce this year's Perry Award recipient, Dr. Mark Lemley. Congratulations, Mark.
Thank you, Dr. Bruns. Dr. Lumley, will you please share your inspirational thoughts with us?
I sure will. And thank you, Dan, for nominating me for this award and the Society for granting it to me. And thank you, Barbara Keaton, for the so many years of support you've provided. I also want to mention a couple of thanks to Howard Schubiner, my longtime colleague, who's been instrumental in helping to develop these approaches, my many students and colleagues who've advanced this work. And I see a few Lumleys on the call here today, one of whom is my wife, Sherry Lumley, who for many decades has provided so much support that she's made this award possible. So Sherry, my career award is also your career award. You know, this Nathan Perry Award, by the way, has unique significance to me because I was a graduate student in the Department of Clinical and Health Psychology in the late 1980s at the University of Florida. And Nate Perry was my department chair. So I got to know him during those 5 years I was there, and I heard him preach the value of the scientist practitioner model a lot. He stressed making sure that our science is clinically relevant and our practice is informed by science. And I hope that the work I've done has exemplified his practices and his preaching. I'd like to, my word of encouragement for students and others would be the following. I'd like us to go beyond our usual way of operating, which tends to be pretty safe and predictable, and actually doesn't have a lot of meaningful change ensuing, I think. I'd like to suggest that we should strive for two things: creativity and courage. Creativity in our practice and our research to think outside of our comfortable and traditional boxes. And courage to explore new models and practices, even if doing so can be personally uncomfortable or elicit some social pushback. I really think that creativity and courage will help more of us to have careers that really make a difference for others. Thank you.
Thank you, Dr. Lumley. That was a really inspirational message, that's for sure. The next award is for excellence in health psychology mentoring and is presented to Dr. Shauna Ehlers of the Mayo Clinic. As is often the case in this award category, numerous mentees combined to nominate Dr. Ehlers. Dr. Elizabeth Kasel will introduce the recipient on behalf of her many trainees. Dr. Kasel.
So thank you so much to the Awards Committee and Division 38 for the opportunity to introduce Dr. Shauna Ehlers, this year's recipient of the Excellence in Health Psychology Mentoring Award. Anyone who knows Dr. Ehlers knows that one of her favorite ways to introduce work in psychosocial oncology, which is her specialty and mine, is to talk about it like compare the quantity of opportunities to the sensation of standing in a candy store. Now, this is both celebratory in terms of the endless sweet and shiny possibilities to follow our passions, as well as cautionary, because we all know that too much candy can lead to a stomachache, and overcommitting too early in our careers can lead to a headache, or 5. Dr. Ehlers has been an active member of the Society for Health Psychology for decades and is actually the president-elect for the society, which is wonderful. And she has made significant contributions in the field in patient care, research, and education. However, like Dr. Ward Zimmerman mentioned, 5 different psychologists all came together with me to nominate her for this award, all of whom are former trainees, because mentorship is an area that she's particularly passionate about. We are very grateful for the opportunity to give her this recognition today and for the many ways that she has helped us in our individual journeys towards meaningful careers and also importantly, meaningful lives. Thank you.
Thank you for those great words. So I can't represent Dr. Ehlers perfectly, but I will share her words of wisdom with you. And she, instead of picking one of the 3 categories, gave a little brief information that she wanted to share in all three. So one lesson I would offer to today's health psychology students or trainees is apply gentle persistence to 3 projects that are important to you. When the environment is supportive for one project, it will move forward because of your gentle, persistent pressure. With this strategy, you always have something moving forward. Your productivity does not depend upon nor fluctuate with the normal ups and downs of a single project. Next, one moment that shaped Dr. Ehler's career trajectory was, there are several small moments I can see in time during which I spoke up from my personal sense of integrity. These moments have been defining for me because they attracted like-minded people who together have advanced translation of best evidence interventions into real-world practice settings. And lastly, she found unexpected inspiration for her work through the following: being witness to patient suffering. I need to advocate for implementation of best evidence cancer care because I am witness to unnecessary suffering that is caused by lack of evidence-based care. We have known how to lessen suffering with evidence-based treatments for 40 years. It is now urgent that we advocate within our institutions and national organizations to adopt policy and promote implementation science that makes best evidence the standard of care. So, and we will definitely share your words with her. So thank you. Our next award is the Excellence in Health Psychology Research Award. This year, the recipient is Dr. Marcy Lobel of Stony Brook University, who will be introduced by Dr. Jada Hamilton. Dr. Hamilton.
Good afternoon, and thank you for this opportunity to introduce one of my favorite people on the planet. It is my distinct honor to introduce Dr. Marcy Lobel as the recipient of the Society of Health Psychology's Excellence in Health Psychology Research Award. Dr. Lobel is a distinguished teaching professor in the area of social and health psychology at Stony Brook University, where she directs the Stress and Reproduction, or STAR, lab. Dr. Lobel's program of research applies social psychological theory to the domains of stress, coping, and health, particularly women's reproductive health, extremely timely and important topic these days. Over more than 3 decades, she has investigated ways in which psychosocial and biopsychosocial factors, namely prenatal maternal stress, coping, and health behaviors, influence maternal and child health among diverse populations. Her work has been foundational in establishing how the stressful life circumstances and conditions that are faced by pregnant women, particularly socioeconomically disadvantaged and marginalized women, can have serious implications for their health and well-being, as well as that of their offspring. Most recently, Dr. Lobel's work has addressed effects of stressors associated with the COVID-19 pandemic on pregnant women across the globe. During her career, she has served as PI, co-PI, or co-I on more than 30 grants. She's published more than 130 peer-reviewed articles and book chapters regarding crucial issues in the psychology of women's health and well-being. She has also been a supportive and unparalleled mentor to 20 doctoral advisees, including me, and she has received numerous national level awards for her teaching, her mentorship, her service, and her scholarship. I feel genuinely privileged to know and to have learned from Marcy as a researcher, a mentor, a colleague, and a friend. She is truly deserving of the honor of the Excellence in Health Psychology Research Award. Thank you.
Well, thank you. That was lovely, Dr. Hamilton. And now a few words from Dr. Lobel.
Jada, what a wonderful surprise. I did not know that you were going to be here today and presenting this award. And I think everyone can see why my lab is named the STAR Lab, because you certainly represent that. I'm so proud of you. Also, I don't know whether you can see my lovely award here. I was asked to make sure it was on camera. It's right here next to my calaveras for Dia de los Muertos. So we're ready for the holiday. I think Jada can attest to the fact that I've always taught my students to do what you love and love what you do. And in my career, I've been very fortunate to achieve that. But yet I realize that not all of us have this privilege. I owe a great deal to others. My own grandmother was never taught to read or write. And yet, merely 2 generations later, her granddaughter graduated from Harvard, received a PhD from UCLA, and is now a psychology professor at Stony Brook University. That truly embodies the American dream, but it wouldn't have been possible without a supportive family, teachers and professors who challenged me, donors who provided scholarships for my education, and funders of my research. I am especially grateful for my students, like Jada, because research projects with them feel like a team sport that we enjoy together, whether we win or lose. I guess I'm referring to grants and publications. And I think that Jada can also attest to the fact that even after we lose, we can still go out and enjoy margaritas together. On most days of my career, I have been excited to wake up and get to work. And that's also because I've had the great fortune to do work that truly helps others lead a healthier and happier life. Our research as health psychologists truly does make a difference. When I started work in the psychology of reproductive health about 40 years ago, you could count on 2 hands the number of studies that focused on stress and its effects in pregnancy. Now there are thousands of studies, many of them scientifically rigorous and theoretically rich. Policymakers, healthcare providers, and our fellow citizens are paying attention to our work as health psychologists, and it's families that are the beneficiaries. I'm very grateful to the Society for recognizing me with this award, but to be honest, doing what I love and loving what I do are the greatest award of all. Thank you.
Well, thank you, Dr. Lobel, truly. Our next award goes to Dr. Stacy Sanford of Northwestern University Feinberg School of Medicine for excellence in clinical health psychology. Dr. Laura Oswald will introduce Dr. Sanford.
Thank you so much. It is truly an honor to get to recognize Stacy for this award and to introduce her. Dr. Stacy Sanford is a full professor and clinician educator in the Department of Psychiatry and Behavioral Sciences and in the Department of Medical Social Sciences at Northwestern University Feinberg School of Medicine. Her career at the Robert H. Lurie Comprehensive Cancer Center of Northwestern University has focused most on advocating for adolescent and young adult cancer survivors ages 15 to 39, as well as promoting advances in science and clinical care for this vulnerable population. Dr. Sanford founded Northwestern's multidisciplinary AYA Oncology Work Group in 2009, and she now serves as co-director of Northwestern's AYA Cancer Program. This program promotes research, advocacy, and optimal standards of care for AYA patients as they receive care across both the Lurie Children's Hospital and the Adult-Focused Cancer Center. Under Dr. Sanford's leadership, the AYA Cancer Program recently hired several new dedicated staff members, which allows them to effectively expand their programmatic reach beyond just the core Northwestern Cancer Center and into 10 satellite clinics across the regional Northwestern medicine healthcare system, which will significantly benefit countless AYA patients and survivors. Dr. Sanford is also a highly sought-after research collaborator, an outstanding role model, and an inspiring clinical supervisor who is helping to shape the next generation of health psychologists in oncology. It's my pleasure to introduce her for this award.
Well, thank you, Dr. Oswald. Dr. Sanford?
Thank you so much, Laura, and thank you for I followed the instructions and I brought my pretty award so everyone could see it. Super grateful. And I'd also like to say thank you to Laura and Rena and Carly and the folks who nominated me for this. My prior fellows nominated me, which is probably the best award of all. So I'll read my remarks. I chose the prompt, "One moment that shaped my career trajectory was when I found myself choosing to respecialize during postdoctoral fellowship. After spending my graduate school and internship training focused on adult and geriatric health psychology, I chose an opportunity to receive training in pediatrics as a postdoc. This was not part of the original plan. This choice was informed by my personal values and the difficult life choices that often accompany dual career relationships. Needless to say, I learned a great deal during those 2 years, with my greatest lesson being the realization I was truly not meant to be a pediatric psychologist. But even so, taking this divergent path was really pivotal in my career. I had been afforded the rare opportunity to gain experience and with the full developmental lifespan, and consequently found I was uniquely suited to grow a career in the emerging field of adolescent and young adult oncology. I've spent the past 16 years doing just that, and I found the work immensely rewarding. And I'm eternally grateful to the Society of Health Psychology for their role in supporting my career development over these years. And I'm deeply honored to accept this prestigious reward. Thank you very much.
Well, thank you, Dr. Sanford. Now, the 2024 Cynthia D. Ballar Award for Excellence in Health Psychology, Education and Training is presented to Dr. Charles Swensionis of Furkoff Graduate School of Psychology. Dr. Elizabeth Singh will give the introduction.
It is my pleasure to introduce Dr. Charlie Swensionis as this year's recipient. Dr. Swensionis served a pivotal role in the early development of the field of health psychology, including chairing the ENT committee, and he actually co-edited, along with Dr. Ballar, the 1983 National Working Conference on Education and Training in Health Psychology, which is the foundational document that outlined the training pathway for people interested in becoming health psychologists and differentiated health psychology as a distinct field within the profession. His leadership during that critical period of definition and growth of the field set up what is now a familiar system of education and training for health psychologists, as we know today. Dr. Swensionis was also among the founding faculty members of the health psychology PhD program at Fairclough Graduate School of Psychology at Yeshiva University in the 80s, which was one of the first PhD programs that was specifically dedicated to the field of health psychology in the country. He continues to serve as a professor there today. He's graduated 84 PhDs in health psychology, although that might be more now. And he's mentored more junior faculty, including me, in best practices in health psychology training. So congratulations, Dr. Swensionis.
Thank you so much, Dr. Sen. I really appreciate this. I would comment about one moment that changed my career. I was in graduate school in the 70s, and although we published a lot of things relevant to health psychology, in places like psychosomatic medicine, they were never really right. They were never the right journals. And there were places that did bench science in health psychology. I was adjacent to one at UCSF, but there were no places that did health psychology research in clinical settings and clinical applications. So I thought there was a great need for this. There were certainly a lot of people doing the work. There were certainly a lot of publications coming out on it. But we needed a place we needed more than one place, but we needed numerous places where this could be done, could be focused on, could be groups of people working on it at once. And so I told everybody I knew. I said, why don't we have something like this? Why don't you start one? Why don't you have one at your institution? And I was doing my first postdoc. I did 2 postdocs. The first one was at UCSF. And one day I was sitting and reading a biography, ironically, of Albert Einstein, when my colleague, Gil Levin, called me from Albert Einstein College of Medicine and said that the dean of the medical school had asked him, what can we do to provoke more research and interchange and training in psychology on the medical school campus? And Gil's idea was that we should start this PhD program. He knew that I had wanted to do this for a very long time because I could not keep my mouth shut about it. And so he called me up and asked if I wanted to come to New York and we could do it together. So naturally I said yes, and I've been here ever since. But it's been a great ride. I did get to do exactly what I wanted to do, and I can't say that it's always been easy. It's frequently been tough, but it was what I wanted to do, and it's made me very happy and made me very proud. Thank you. Thank you, all of you.
Wow, how cool is that? Thank you. Now presenting the award for Volunteer of the Year to Dr. Casey Kavanaugh of the University of Virginia School of Medicine is our Society for Health Psychology Administrative Officer, Barbara Keaton.
For your consideration, building a website is a lot like having a baby. What looks like an intuitive, effortless process turns out to be fraught with uncertainty, takes longer, and costs more than anticipated. So many decisions must be made. What will we call it? What colors will look good? What space will we need? And what happens as it grows? During both pregnancy and web development, many people are willing to make suggestions about what to do and how to do it, but fewer volunteer to see it through. Casey Kavanaugh stepped up to face the challenge of building a new website for the Society for Health Psychology. She assessed all aspects of our previous site, applied the best practices in communications and technology, and expanded services while simultaneously simplifying the site to make it more engaging on multiple platforms. We're grateful to Casey as web editor-in-chief for her commitment. But more than that, we're enriched by her insight, organization, and collegiality. Not many people could produce a new site in under a year while maintaining their professional responsibilities and, oh yes, actually having a baby. The Society for Health Psychology thanks Dr. Casey Kavanaugh for her professional generosity and look forward to her continuing participation.
Great, what a wonderful introduction. And Dr. Kavanaugh, please present your comments on the value of volunteer service.
Thank you so much for everybody. And obviously, Barbara, thank you so much for that introduction. I am honored to receive this award for service at the Society of Health Psychology. It is a privilege and a joy to volunteer for this organization that dedicates itself to improving the lives of individuals and society through health promotion and research. I would like to thank Barbara Keaton for selecting me to receive this award, and for Barbara and Steph Brown's amazing support of our work over this past year. Definitely couldn't have been done without a lot of people involved in this. I would also like to extend my gratitude to all of the Society's other volunteers whose collective efforts and commitment enhances our work and makes a difference in our field. I'm inspired by the Society for Health Psychology and our work together. I look forward to continuing to contribute to the Society's mission. Thank you once again for this great honor.
Well, thank you from the bottom of our hearts, Dr. Kavanaugh. Next, we shift to the Early Career Professionals Awards and begin with 2 awards for excellence in health psychology research by an early career professional. The first will be presented to Dr. Diana Chirinos of the Feinberg School of Medicine of Northwestern University by Dr. John Ruiz. John?
Good afternoon, everybody. And first of all, congratulations to all of today's award winners. It's wonderful to have a moment like this in the middle of the day. It's a nice respite from the other activities. But I specifically want to focus on Early Career Award, and it is my absolute pleasure to recognize Dr. Diana Chirinos for the Excellence in Health Psychology Research by an Early Career Professional Award. Dr. Chirinos is an outstanding early career Latina scholar and assistant professor in the Feinberg School of Medicine at Northwestern University. She earned her PhD from the prestigious clinical health psychology program at the University of Miami, working with luminaries like Dr. Neil Schneiderman, Maria Yabre, and the many others there. Boy, I'm already reading that line. I'm jealous of her background. Her work seeks to understand the role of socio-demographic and psychological factors, such as depression and sleep disturbance as determinants of cardiovascular disease, in particular for vulnerable populations. She's currently funded under a K01 through NHLBI. She has some 60 publications, and her work appears in all the places where you would dream your work to be, including the Annals of Behavioral Medicine, Psychosomatic Medicine, BMJ Open, Sleep, and other critical outlets. In 2023, Diana earned the Early Investigator Award from the Academy of Behavioral Medicine Research, a very, very prestigious recognition, just like this one. And in that same year, she was chosen as one of the 7 inaugural APA Associate Editor Fellows to the journal Health Psychology, our very own Health Psychology. And honestly, I was so impressed with her work that in 2024, she was promoted to the role of Associate Editor with the journal where she now serves. These are all, you can't even, I think you can sort of lay out the breadcrumbs sometimes and see where things are going. And this is one of those cases where these are all the hallmarks of just outstanding early career contributions. It just checks all the boxes, and we can sort of see where this is leading. I'm sure we'll be back here in 20 years for a senior level award for her. But please join me in congratulating Dr. Diana Chirinos.
Thank you, Dr. Ruiz. Now, Dr. Chirinos, please share your reflections.
Sure. First, I want to thank Dr. Ruiz for nominating me for the award. It has been wonderful to get to know him through working with the journal, and it's really an honor to be in this call with so many people that I really admire and look up to. And I'm really excited that this was the year where I was chosen to win this award, with Stephanie being the president of the society. I'm going to give my remarks about early graduate students, and I just wanted to share that I met Stephanie when I interviewed as a graduate student in Miami and have looked up to her ever since. And so I'm really excited that this just happened to be the year. One lesson I would offer to all health psychology trainees and students is to let go of the expectation to excel in every single area. I think right now there's so much pressure to be the best at absolutely everything. And this kind of pursuit of perfection can be really overwhelming, and most importantly, unsustainable. And so instead, what I did, and hopefully it's something that would be helpful, is to choose to focus on discovering areas that really ignite your passion and that you invest really deeply in those. And it's perfectly fine not to be exceptional in absolutely everything, but dedicating oneself to the thing that resonates most with you. And by having a little bit of that balance, you not only reduce unnecessary pressure, but you also allow your strengths to shine where they matter most. And most importantly, this approach is likely to lead to more meaningful contributions and personal fulfillment in our work. And again, thank you very much for choosing me for this award this year.
Well, and thank you for sharing those lessons. Appreciate that. The 2024 Society for Health Psychology Awards Committee also recognizes Dr. Claire Conley of Georgetown Lombardi Comprehensive Cancer Center. Her introduction was prepared by Dr. Barbara Anderson. Dr. Anderson is unable to join us today, so I will read the introduction on her behalf. And I quote, "I am fortunate being asked to tell you a bit about the 2024 awardee for excellence in health psychology research by an early career professional for the Society. In doing so, I am selfishly asking, if I am still around, that I be considered to introduce Claire again when she receives the Senior Investigator Award." She'll be doing that, I guess, with Diana. Diana, you both can earn that award in the future. I know that will happen as her work today is far beyond that often seen for early career research awards. Already, she has 40+ publications, externally funded work, and 2 programmatic lines of research. Young faculty are typically discouraged from trying to have more than one, as it is hard enough to do all the things you need to do for one and then replicate it with a new topic. Thus, what Claire is doing is linking research on risk for cancer with her research on challenges of advanced disease, the ends of a continua, by focusing upon personalized medicine, preference-sensitive care, and shared decision-making. Claire has accelerated her work exponentially since her upward trajectory that I saw during her time in graduate school at Ohio State. Claire was always there with ideas, persistence, and being nonplussed by new projects and opportunities. A joy with whom to work, she was the type of student for which I quickly realized that I just needed to get out of her way so as not to slow her down. So I will step aside now, Claire, and just wish you Godspeed and happiness as you continue your important life's work. So clearly, Dr. Anderson's words are heartfelt. And Dr. Conley, we now look forward to your insights.
Thank you. And thank you so much for stepping in, Dr. Ward-Zimmerman. Also wonderful to hear from you. So I think really interesting. I also wanted to speak a little bit to passion. So I guess Diana and I are on the same wavelength in a lot of ways. And so I wanted to respond to the prompt of one lesson I would offer today's health psychology students. And it is to find a clinical or research area that you're truly passionate about, not just one that you think is reliable or just fundable, which I think we're all thinking about these days. And when I was starting to work on my dissertation, I told my advisor, Barb Anderson, that the topic I was leaning towards was the one that I thought I would hate the least at the end of it. And after a beat, she said that not hating it wasn't good enough. And that she would help me find a topic that really spoke to me. And because of that, I felt really supported to go outside of my comfort zone and do research with a population that I had no experience in, which was people who were unaffected by cancer, but at high risk for breast cancer. And that line of work eventually led me to my postdoctoral fellowship and to the faculty position that I'm in today. And I don't think if I had gone out of my comfort zone, if I hadn't tapped into my passions, I wouldn't have had the motivation and the drive to continue in research, which is really tough. It's a really tough path. And so I think the passion really helps get you through and over the hurdles. So thank you. And thank you for the award and the recognition. And I am in very good company today. Thanks.
Yes. Well, thank you, Dr. Conley. Now, the 2024 Award for Excellence in Clinical Health Psychology by an Early Career Professional is presented to Dr. Alyssa Vila of Northwestern University Feinberg School of Medicine by Dr. Allison Gaffey. Dr. Gaffey.
Thank you so much. I'm honored and excited to introduce Dr. Alyssa Vila as recipient of the Excellence in Clinical Health Psychology by an Early Career Professional Award. Throughout her career, Dr. Vila has continually demonstrated excellence. Since joining the Cardiac Behavioral Medicine Service at the Northwestern University Feinberg School of Medicine, Dr. Vila has been committed to improving cardiovascular health equity through the implementation of clinical service, program development, research, education, and advocacy. In the Department of Surgery, Dr. Vila has also developed other important services, including an integrated behavioral medicine clinic for heart transplant recipients. Her efforts have reinforced the importance of advocacy and education in health equity, and she was recently appointed as Vice Chair of Equity. Simultaneously, Dr. Vila has championed these services nationally through the Society of Behavioral Medicine's Cardiovascular Disease Special Interest Group, including serving as chair. Dr. Vila has led key initiatives educating patients on connections between cardiovascular and behavioral health, advocating intensive behavioral counseling for cardiovascular prevention, and highlighting a need to better integrate intensive behavioral counseling and the value of health psychology. Together, these efforts exemplify Dr. Vila's desire to see a greater impact of cardiovascular behavioral medicine beyond the very institutions, of which there are few, with access to a health psychologist with cardiovascular expertise. Overall, Dr. Vila is, and I expect will continue to be, an exceptional leader in our field and is well deserving of this award. Congratulations.
Wow. Thank you, Dr. Gaffey. And now, Dr. Vila, would you please share some thoughts?
Thank you, Dr. Gaffey. That was really lovely of you. What an honor to receive this award and be amongst this group. There's so many people that I look up to on this call and so many people who are colleagues and close friends. And I just feel really honored to be a part of this wonderful group and celebration this afternoon. You know, when I was reflecting on the prompts, I think there was some overlap with what others are sharing. And the question about a moment really took me back actually to some experiences that I had on internship at the Lewis Stokes Cleveland VA Medical Center and got me thinking about, similar to what Claire said, and of course we trained together on internship, which was wonderful, the importance of getting outside of my comfort zone and really leaning into opportunities for mentorship. So I didn't have any experience in cardiology or transplant going into internship. That's not even what I trained in my postdoc, but those experiences really interested me and gave me the skill set to come into this position at Northwestern and really run with it. Continuing to seek out experiences that were not always the most comfortable, and leadership and other opportunities has been really essential to my career development. And similarly, I had a supervisor on internship who remarked on my interest in health equity and really pointed out the things that I kept bringing up in our supervision and really encouraged me to incorporate that into my work. And now I feel so honored to do health equity work in my clinical practice and research and teaching. So thank you so much.
Barbara, you're muted.
Thank you for letting me know. Sorry about that. And thank you, Dr. Vila, for your words. At this time, the Society would like to recognize this year's outstanding postdocs in research and in clinical practice. These awards are given through the Society's Early Career Professionals Council. The Postdoc Research Award in the amount of $2,500 is granted to help support and outstanding postdocs' original research. Clinical awards of $380 each are given to selected Society for Health Psychology members to defray costs related to the examination for professional practice in psychology clinical licensure exam. And then our next award is vetted by both the Health Research Council and the International Research and Collaboration Interest Group, and is titled the Health and Behavior International Collaborative Award. A grant of $3,000 is given to facilitate a mentorship collaboration with an international laboratory or research group under the guidance of an identified international mentor. Nice. We will now turn our attention to recognizing some of our outstanding graduate student researchers. Dr. Josh Iyer, the 2024 Chair of the Society's Health Research Council, will make the announcements.
Thank you, Dr. Ward Zimmerman. The research proposals recognized today were submitted by graduate students and selected by the Health Research Council. And I'm going to go off script here for just a second to say it was an incredible year, incredibly competitive. We had 34 applications, and these folks were clear winners. It was an awesome year. So $2,000 in research support from the Society for Health Psychology accompanies each award. And we invite potential applicants for next year's award, which are due January 31st, 2025, to join us for an informational webinar in November. Registration details will be posted on the Society listservs. In addition to awards in general health psychology and in health disparities, the Society recently added a research award to promote inclusion, which provides a graduate student from an underrepresented group with funding to allow them to successfully complete a health psychology relevant research project. So the 2024 Graduate Student Research Awards in the general category go to Fiona Horner of Carnegie Mellon University for time-varying psychosocial influences of blood glucose among adults with type 1 diabetes. And I was checking earlier, most of the folks are on the call, so definitely applaud them. Also, Kayla Pitchford of Old Dominion University for a mixed methods investigation for guided intervention of body image disturbance among younger Black women breast cancer survivors. Sophia Rentel of Rosalind Franklin University of Medicine and Science for cognitions and traumatic stress symptoms in Spanish-speaking caregivers of children hospitalized in the PICU, a mixed methods study. I mean, that gets applause just for that title, right? These are amazing proposals. Catherine Wall of Virginia Commonwealth University for From Trans Health to Vaccines, a theoretically driven model exploring factors related to susceptibility to medical misinformation. The 2024 Addressing Health Disparities Award went to Erin Pareda of the University of Massachusetts, Boston for exploring transgender and gender diverse youth experiences with vicarious minority stress. And the award for promoting inclusion was given to Ria Nishikawara of the University of British Columbia for healthcare experiences of gender and sexual minority patients with endometriosis. Just a phenomenal group of applicants. And these proposals were so good, y'all. I wish that y'all could read them. And in fact, if you want to, you can join in with our future evaluations of these winners. So just a wonderful crop that we had this year. And related to that, the Health Research Council would also like to recognize 8 additional applicants with honorable mention and a free 2025 membership in the Society. We look forward to their ongoing contributions to health psychology research. All of these names are names we'll be hearing for a long time to come. So congratulations to all of y'all. The Health Research Council would also like to express special thanks to all the applicants and reviewers who participated this year. And we would now like to take a moment for some special recognition of Society members. Dr. Mark Vogel, 2023-2024 Society President, will preside.
Well, I have one remaining task for my 2023-24 president, and this is a real pleasure. Now, this was presented in person at the AP convention, but we wanted to make a moment here to publicly recognize Dr. Lloyd Berg with the Society Presidential Citation for his extraordinary efforts in chairing the 2024 task force, which is preparing the application for the recognition of clinical health psychology as a specialty, something we have to do every 7 years, as well as his other contributions to health psychology education, training, and practice. And I'll read the citation that was given to him. The Society for Health Psychology expresses sincere gratitude to Dr. Lloyd Berg for his dedicated leadership as chair of the Clinical Health Psychology Specialty Council and his pivotal role in overseeing the 2024-25 CRISP reapplication process for the specialty. Dr. Berg has significantly contributed to raising awareness of clinical health psychology, both within the field of psychology and among the general public. He has played a crucial role in organizing and disseminating the education and training taxonomy for clinical health psychology and advocating for its widespread adoption. Additionally, Dr. Berg assumed leadership role in the team responsible for organizing the development of the CRISP renewal application, demonstrating his commitment to advancing the specialty. And just on a personal level, Dr. Berg served as a passionate advocate for the specialty and for board certification. And he previously held the position of president of the American Academy of Clinical Health Psychology and currently serves as the board of directors of the Council of Specialties in Professional Psychology. So many thanks to Dr. Berg. And I don't know, is Dr. Berg on? I know he was on. I saw him earlier, but my screen is such I can't see him. But I think anyway. So back to you, Dr. Ward Zimmerman.
Okay, thank you, Dr. Vogel. So this concludes the Society's formal awards presentation for 2024. And as many of you have said verbally and in the chat, very, very impressive group of awardees. If you have been inspired today, please visit our website to learn more about the Society for Health Psychology Awards and Recognition Program and nominate or apply yourself for 2025. And now, Dr. Stephanie Fitzpatrick will close our ceremonies with some brief announcements and recognition of member milestones this year. Dr. Fitzpatrick.
Before we end our ceremonies tonight, it is our tradition each year to welcome future health psychologists. Arden Sage Iyer, child of Holly Kennedy and Josh Iyer, born May the 11th. And Dante Logan Wallace, child of Amy Cruz and Damian Wallace, born August 14th. Josh Iyer is our chair of our Health Research Council, and Amy Cruz is the chair of our Consultation Liaison Interest Group. Congrats to both of you all. Bring them up right, get them into the Society for Health Psychology early. I also want to take a moment to respectfully remember our colleagues that we lost in the past year, including Dr. Nancy Adler, Dr. Norman B. Anderson, Dr. James Prochaska, and Dr. Neil Schneiderman. We also remember friends, loved ones, and colleagues not named at this time whose support and influence enriched our world. If you have a special milestone in the next year that you would like to share with your society colleagues, please let us know. I also just want to take a moment just to break from the script and acknowledge those who were appointed as fellows of the Society for Health Psychology this year. I'm not sure the number right off, but I just want to make sure that I acknowledge those folks because that is a huge accomplishment. That means that you have done tremendous work in your career, whether that's clinically, research, advocacy. And so just want to acknowledge those who were appointed fellows this year. And thank you to Dr. Mark Lumley for helping folks through that process. Finally, we are pleased to announce the newly elected and appointed board members for the coming term and thank those whose terms are coming to an end. Thank you all for all of your service to the society. And finally, we like to recognize the first two cohorts of editorial fellows for health psychology. In collaboration with APA Publications, the Society has embraced this new fellowship program to elevate leadership opportunities for ECPs from historically excluded groups, particularly Black, Hispanic, Latino, Latina, Indigenous, and other psychologists of color, as well as members from other communities which have been historically excluded from leadership opportunities in research and publishing. Thank you for joining us in this celebration of Society members and their achievements. We welcome your ongoing participation. Please plan now to submit presentations for the 2025 program at the APA Convention to be held in Denver, Colorado, August 7th through 9th. And we are adjourned. Thank you, everyone.
Yes, congratulations and thank you, everyone.